And welcome to Talk of the Town. I'm Robyn Zimmerman. We have Dieesha Hicks with her monthly update. As you know, she is the State Health Insurance Program Manager. She's coming to us via Zoom. Dieesha, it's good to see you. Again, you said you just got back from vacation.
I did. Good morning.
Good morning. Great to have you with us. We're going to jump right in and kind of peel back some of these issues. The first topic you want to talk about is SMP, and I'm not sure what that stands for, so I'm just going to let you take it away.
So SMP is another program that I manage here at the COG. It stands for the Senior Medicare Patrol. And so what we're here to do is help people learn how to protect themselves against fraud, be able to detect fraud and report fraud. So kind of keeping them aware, teaching them how to spot it out, how to read their Medicare summary notices, also how to read their explanation of benefits, just so they know what they're looking at and if they can actually prevent some of those errors and those frauds.
All right, so let's just dig down a little bit further on Medicare fraud, Dieesha. So what are some of the ways in which people are being defrauded on the Medicare side?
One that has been very heightened right now that we get a lot of calls on is people getting calls telling them that they're going to get a new Medicare card. You are not getting a new Medicare card. Because they're telling them that they're going to have one with a chip or they're going to get a plastic one. It's going to be the same paperback copy that you have. Those individuals are just trying to get your Medicare number, which they will sell off to different companies.
Well, that's interesting. I didn't think that you could actually do that. Take somebody else's Medicare number and then you said sell off to other companies?
Sell it off or either charge Medicare for fraudulent things that you haven't ordered or even doctor visits that you've never been to. Like, it's so wide range. Like, Medicare loses about $60 billion a year to Medicare fraud.
Right. You know, when I get my Medicare information in the mail from procedures or whatever, I don't really look at it very much in detail. Should we be doing that?
I believe so. People usually don't pay attention to it unless they get something that Medicare doesn't cover and they see that they're going to get a bill. That's when people usually kind of pay attention to it. But just briefly skim through it. If something doesn't look correct, you could just give us a call. There's no harm, no foul in checking something out.
All right. Back to your SMP. That's a wonderful, is that a new program?
No.
Okay.
It's been here. So usually it's like, so I tell people also, if you get something in the mail that your doctor did not prescribe, one thing with people were getting catheters in the mail, or if you get a back brace or some kind of brace that your doctor did not prescribe you, that means that your Medicare number has most likely been compromised and you're being billed for things that you did not order or that your doctor did not order. So the best thing to do with those is if you receive a packet of some kind of medical device, send it right back to the company and then let us know.
Okay, very good. And so our final topic is Prevention Week. Is that this particular week or?
It starts on June 2nd. So it's June 2nd through June 8th. And that's when we really try to push that issue of like the community coming together. So each day is focused on a different person from the community. So the first day is the actual Medicare beneficiary. Then we have providers, like we want the hospitals and the doctors to be kind of aware and kind of listening to what those clients are telling them, because they might pick up on something that the client didn't know themselves. Community leaders, people that are caregiving for their family, because in the long run, if you're helping mom or dad or grandma pay for these medical bills, you may be paying for something that you don't have to. So we want them to kind of be aware of that as well.
Okay, very good. Thank you so much, Dieesha. Appreciate this important information about Medicare fraud.
No problem. And one more thing, we are always looking for volunteers to kind of help spread the word. Like, just if you come learn a little bit about it and you're in the community or you're a community leader, you're in the church, you can also share this with your family and friends. Just kind of keep everybody aware of what's going on around them.
Perfect. Great. Thanks so much, Dieesha. Appreciate your time.
Thank you.